Belly pain, or what most parents call a tummy ache, really common among kids, and it's often pretty harmless.
But a new poll finds a concerning number of children have tummy pain at least once a month, and their parents aren't contacting their child's doctor as often as they should. Dr. Frank McGeorge joins us with the reasons behind those decisions and the red flags that parents should be watching for. Doc.
Well, you know, Kim and Devin, often by the time a child gets to me in the emergency room, their parents have already talked to their doctor and identified a concern that we evaluate. In many cases, however, the children and their parents don't get any doctor's insight, which is really a missed opportunity.
We found that 1 in 6 parents report that their child has abdominal pain at least once a month, which is really quite frequent. Amongst those parents whose children have pain at least once a month, 42% of them don't contact their child's primary care provider.
Dr. Susan Wolford is a pediatrician and co-director of the University of Michigan Health C.S. Mott Children's Hospital Poll on Children's Health. She says this is worrisome because abdominal pain occurring that frequently can have a serious impact on a child and their family's life.
The primary care provider could serve as a partner for parents in trying to, 1, work out the cause of the abdominal pain, and 2, help with treatment.
Another finding in the poll, often the abdominal discomfort was not a physical issue.
We found that approximately 1 in 4 parents reported that their child has pain that's due to something like anxiety, worry, or school avoidance. This is very concerning because such pain can be really hard to treat.
The most common way parents handled anxiety-related belly pain was talking with the child 71% of the time, using relaxation exercises 53%, distracting them 53%, and allowing them to miss school or activities 16% of the time.
Now, if you don't contact your child's doctor, some red flags of something more concerning to watch for are any associated fevers, vomiting, blood in the vomit or stool, intense pain that wakes a child or limits their activity, and specific locations of the pain, like, for example, the right lower abdomen that might be your appendix.
Sure. I think that the anxiety thing is a great thing that you bring up. My 4-year-old this morning, he was anxious about going to summer camp. He was going in a new building. He didn't know where he was going to put his book bag, so he said, "My stomach is hurting," and I thought,
Right.
Oh my goodness. But it's really interesting. Do you find that parents are good at figuring out what causes, though, the child's bellyache? In this case, I knew that it was anxiety. But
Stress, yeah.
Stress, yeah. Even though he's only 4, he's stressed about where to put his book bag.
Well, and to be fair, a lot of times kids actually don't know exactly how to describe it. So the best they can say is, "My tummy hurts."
Yeah.
But you know, in this study, the poll actually found 2/3 of parents indicated that they were not very certain that they could tell the difference between serious and non-serious causes. And I tend to agree with that. But I do find parents can tell when something is different with their child, and that is really the most important thing. If you can identify something different, new, that's when you need to bring it to someone's attention.
Yeah, not when they're anxious about where to put their book bag.
And if that's your sense, then that's actually a very valid parental sense.
That's right. Yep.
Okay, thanks, Doc.